Hi guys, my name is Niyati and welcome to this Chegg tutorial video. I mostly tutor biology and medicine related subjects here on Chegg, and today we are going to learn a little bit about ABI or ankle-brachial index. So jumping right into it, what is ABI? So the ABI or ankle-brachial index is basically a numerical value. It's a ratio of the resting systolic blood pressure at the ankle divided by the systolic blood pressure at your arm in your brachial artery. So you basically just take these two values, measure them, and divide the blood pressure at your ankle, systolic blood pressure at your ankle, divided by the systolic blood pressure at your arm. So why do we use it? So the main reason why we use this ABI or ankle brachial index is to help us diagnose PAD or peripheral arterial disease, which is basically disease that affects vasculature of the extremities, including the feet, the lower limbs, or the arms, or any. Basically, it can affect any of the vasculature in the body, and depending on that, you get symptoms. So how do we interpret the ABI? So let's take a look at that. So normally, the ABI is 0.9 up to 1.3. So this is a normal value. So in a normal person, your blood pressure in your ankle should be higher than the blood pressure in your brachial artery. So 0.9 to 1.3 is kind of the normal value, and if you get a normal value, it generally excludes the diagnosis of peripheral arterial disease. So if the value is more than 1.3, this is suggestive of calcification of the vessels, which makes the vessels less compliant, which can change the pressure measurement. So if it's more than 1.3, it's suggestive of calcified vessels. And an ABI of less than 0.9, this is the important one here. If it's less than 0.9, this diagnoses or is diagnostic of occlusive arterial disease in symptomatic patients. So of course you have to correlate this with the clinical presentation and risk factors that the patient has. So some of the common risk factors for peripheral arterial disease, or sometimes also called PVD, which is peripheral vascular disease, include things like hypertension, diabetes. These are the two main ones. Smoking is also an important risk factor for peripheral arterial disease, family history. So you have to look at all these different risk factors as well as symptoms. So common symptoms of PAD include one important one is pain, pulselessness, pallor, paresthesia. So there's like 4 P's. So that's how you can remember it. Pain is the most common one, where claudication is the most common type of symptom. And claudication is the pain that arises that starts in the lower limbs after walking. So when the increased demand occurs in the feet during exercise, during walking, and the blood supply, because of the narrowing in the arteries, is insufficient to keep up with the increased demand. So that's when people will complain of claudication pain. And most commonly they say, I start walking and then I can only walk a couple of feet or a couple of meters before the pain in my leg starts to really bother me. So that distance is often called claudication distance. So this pain is very characteristic of peripheral arterial disease. And then other things like basically signs of ischemia to the limb. So your limbs going numb, which is paresthesias, or feeling pins and needles kind of a sensation, or pallor, where the limb is just pale and cold. Pulselessness, pallor, paresthesias. Pulselessness is when you try to feel the peripheral pulses. For example, the dorsalis pedis pulse in the lower limb. You will get either a feeble pulse, or depending on how much the artery is occluded, it may or may not be palpable at all. So these are certain clinical signs and symptoms and history and risk factors that you have to include when you consider the big picture here. But the ABI is a simple and quick and non-invasive way to basically help us try to diagnose peripheral arterial disease. Recapping again, normal values is between 0.9 to 1.3. This generally excludes peripheral arterial disease if your value is within this range. If it's more than 1.3, suggestive of calcification. Less than 0.9, suggestive of peripheral arterial disease. A low ABI is often associated with increased risk of things like coronary artery disease, transient ischemic attacks, strokes, and progressive renal failure as well. So those are just some things to keep in mind. That basically covers up covers the topic of ABI. I hope you enjoyed this video. I hope it helped. The link to my Chegg Tutor profile is down below if you have any more questions. I hope you have a great rest of the day, and thank you so much for watching. Bye.